some common misconceptions about diabetes?
Well, there's some whopping misconceptions about diabetes. The most obvious to us as scientists is that diabetes is often thought of as a blood sugar disease, and it really is not. Diabetes is a disease of improper body-wide metabolism. Now, metabolism is technically where you take a nutrient and you turn it into energy. And the problem with diabetes is they don't make energy properly. And because they don't make energy properly, we say that there's a disease of improper metabolism. The important thing to note here is that you can have absolutely perfect blood sugar and still be very sick with diabetes. There's a conception out there, I think some of our movie stars have added to it, who say, well, I check my blood sugar and I'm going to be okay. Well, guess what? They never are, and they can't be. Because when we check their metabolism, which is easy to do, we find that they don't burn carbohydrates properly. And when they don't burn and store carbohydrates properly, they become ill. And so we'll go into all the pathophysiological aspects of not being able to have proper metabolism. But the whopping misconception of all, and you see it even among some of my colleagues and practitioners, is that if I just keep my blood sugar okay, I'll be okay. Now, it is true that if you don't try to modulate your blood sugar and keep it within certain bounds, that exacerbates and makes worse the problems associated with diabetes. That's very true. So we do want the patients to keep their blood sugars normal. But is that going to stop the complications of diabetes? Absolutely not. As a matter of fact, there are many studies that show that, and we'll talk about those later. But if there's one takeaway to be made here, it's let's stop worrying about the blood sugar as much as we worry about metabolism, and then we'll be doing the patient a great service. That's probably the biggest misconception of all, and it even permeates all the way through colleagues and physicians.
Great.
Action.
Just say that, right?
Yeah.
Okay. So you're telling me diabetes is just like leprosy?
Very much. You see, in the old days, let's say, when leper colonies existed, they thought that leprosy was brought on by sin. And they didn't really understand about bacteria and things like that. And nowadays, we call diabetes the leprosy of the 21st century, because people mistakenly believe that it is their own failures. It's the self-induced disease we often hear. It's because I ate too much, I got fat, and I got diabetes. All false. Diabetes is not a disease of fat. And there are people out there who are morbidly obese, monstrously obese, and they don't have diabetes. And there are people who are not obese and do. And the difference between the two groups is always the same: inflammatory disease response. You see, diabetes is a disease of inflammation. Even type 1 is a disease of inflammation, although there's a step before the inflammatory process. Type 1 diabetic people don't make insulin, and this is because their body has killed off the little islet cells, the islets of Langerhans, or the beta cells, that produce insulin in the pancreas. They don't make any more insulin because their body looked at those little cells and said, this is a foreign body, we've got to kill it off. So type 1 people literally kill off their own cells that make insulin because their autoimmune system is gone berserk. And so we commonly say type 1 is a disease of autoimmune disease. And then after they become diabetic from this lack of insulin, they then turn into an inflammatory disease. That's why diabetes 1 and 2, or types 1 and 2, are both at their very core inflammatory processes. And what do they have in common? It's the same thing. Neither one process carbohydrates properly. And if you don't process carbohydrates properly and your metabolism is skewed toward lipids and free fatty acids, you immediately have these inflammatory processes, which we'll discuss later, called inflammatory cytokines. But the bottom line is, diabetes is a disease that is very, very active in the inflammatory process, and people think they brought it on themselves. Absolutely false. And so it's like the leprosy of the 21st century, because people think they brought it on themselves just like the lepers did in the old days, and they didn't do it either. So we should stop punishing these diabetic people for being themselves, because how do you get diabetes? Both of them are genetic. And you can't get diabetes from being fat or eating too much. You can just get a little worse, but you cannot get it from doing that.